And welcome back to Western New York Living. It's a fact. We all know that smoking is bad and can cause health-related issues. But I'm not here today to preach to smokers about quitting. What I do want to make smokers aware of is low-dose CT lung cancer screenings that are performed at Winsong Radiology Group. It can help detect lung cancer in its earliest stages when treatment is most effective. As I found out recently, it's a simple screening that's saving lives. We've all heard the saying, facts never lie. When it comes to cancer, studies show more women and men die each year of lung cancer than any other cancer. With these facts, it is shocking to know only 2% of eligible individuals take advantage of low-dose CT lung cancer screenings. Dr. Raja Cheruvu and Winsong Radiology Group understand the importance of increasing the awareness of this simple screening.
Lung cancer screening has been available for the last 4 years, but unfortunately only 2% of the eligible people are actually being screened. There are actually 7 million people in the United States who are eligible for lung cancer screening, but only 140,000 have been screened over the last 4 years. And it's very important to get caught early. If patients get lung cancer diagnosed at an early stage, at stage 1, the survival rate is greater than 90%. If they get diagnosed at a late stage, stage 4, lung cancer survival actually is less than 5%.
Winsong Radiology Group has been designated a lung cancer screening center by the American College of Radiology. Those patients that meet the criteria established by the United States Preventive Services Task Force are eligible for the screenings and other services Winsong provides.
Right now, the criteria are such that patients who have smoked who are between the ages of 55 to 80 and have had a 30-pack year history. In other words, have smoked 1 pack a day for 30 years, 2 packs a day for 15 years, so on and so forth, and have smoked, or either a current smoker or have smoked within the last 15 years are eligible for lung cancer screening. The patient has a scan done. It just takes a few minutes long. It just takes actually about 30 seconds to get the scan done. The patient is in and out the front door in about 30 minutes, and then they'll get the results, or their doctor will get the results within a couple of days. We also provide patient care prior to the scan and after the exam. So in other words, patient comes in and they get actually counseled by one of our lung navigators, and they get set up for actually a smoking cessation program. Since it's a approved screening exam, there's actually no copay. So in other words, a patient will come in, they can get their scan done, and similar to a mammogram, for instance, they don't have to pay out of pocket for the exam.
Since beginning lung cancer screenings back in 2014, Winsong Radiology Group has seen an increased number of lifelong smokers who understand the importance of this type of screening. But Dr. Cheruvu knows more people can benefit from their services.
Well, I know it's an anxiety-provoking experience, but I think of course it's very important to get the screening exam. Most of our patients, fortunately, who have a long-standing smoking history come in and get the scan done, and they get good news. They have no nodules, and then of course we continue to follow them. Of course, if we do see a nodule, it's oftentimes difficult to tell whether it's malignant or it's benign. Of course, if the nodule has been present in the past, it's more likely benign, and then we can follow it closely. And it's important, I think, especially in our role as medical providers, to provide early detection. And I think lung cancer screening is a centerpiece of that. As I said, it's very important to catch the disease early, and I think if we can stay on the forefront of technology, we can catch those cancers at a much earlier stage and hopefully increase survival.
To find out more about low-dose CT lung cancer screenings at Winsong Radiology Group, you can head over to their website, which is winsongradiology.com. Remember, there is a certain criteria you must meet, but if you're a lifelong smoker, this screening can help detect lung cancer in its earliest stages. To schedule an appointment to see if you qualify, call 631-2500. Their main offices are located at Spindrift Drive in Williamsville.